Why did you consider an office-based practice over a traditional hospital-based practice?
For me, there are three things that drove me to transition from a traditional hospital-based practice to an outpatient practice. And those three things come down to autonomy, efficiency, and financial. From an autonomy standpoint, in a hospital, sometimes your hands are tied. Your hands are tied by an administrator who may or may not want you to do a certain type of procedure. Also, your hands may be tied if you're part of a traditional diagnostic radiology group who wants you to read a certain number of studies and not do procedures that you want to do. So the autonomy in the outpatient practice comes in. Ideally, you'll get to do procedures that you want to do, that you think are beneficial for your patients, and you can offer them. The second big reason for me to transition over to this setting was efficiency. Our turnaround times on a room, changing the room around from one patient to the next, is very, very minimal. It averages about 15 to 20 minutes. That's never been the case for me in the hospital setting. And so having a well-motivated group of workers, techs, nurses who are interested in making it a very efficient day, turning around cases, doing them on time, getting the patient on the table, adds a lot of satisfaction to my daily routine. The third one is a plus minus. It's a financial benefit. Now, when you're in a hospital setting, you can only bill for your professional component of a procedure. When you're in an outpatient facility, you get a much larger fee. However, it's lower than what the hospital will be getting. So if you own your own facility, you stand to benefit more financially by being in an outpatient practice. But that comes with a big risk. The risk is that you're now responsible for the day-to-day operations. You're responsible for making sure that cases are coming in. So really, it's a plus minus, but if you can make it run well, the financial benefit could make it worthwhile.